A dental practice in general, and this is from the old days of when I first started practicing, that there's 10 years to build, 10 years to enjoy, and 10 years to lose. I didn't want to get to the point where this practice started going downhill.
Our job is to get the highest number, but our main job is to find a group where the deal makes sense for both parties so that both parties want to do the deal.
If I was going to transition, either with an individual or a group or whatever, I wanted someone who, number one, was kind of philosophically aligned where I was, in terms of patient care, practice management. I just, off the top of my head one day, I said, there was a FedEx envelope from some guy here in Austin. So I pulled it out, read about the group a little bit, and right then I picked up the phone, called Thomas. And it didn't take me long to figure out that, hey, this guy's different, this group is different, this is a group I can trust.
The pitch here was, hey, this is possibly the oldest, most established practice in Cedar Park. It was like the original Cedar Park pediatric dentistry practice, hence the name. Like the other pediatric dentist around here would kill to have that name. Think of how well that scores on SEO and all this other stuff, and Dr. Vasut's not even doing that yet. So you're starting to sell upside. You're starting to sell his name and reputation.
You talk about an impressive bunch. I mean, there's the volumes of information that is required to do one of these things, the detail, the follow-up. I mean, there's no way I could have done it. But they were, every one of them answered the phone right away, was very responsive to any concerns we had, or, hey, we can't find this, well, let us jump in and help you find it. Thomas can correct me if I'm wrong, but I think he brought 8. And then we kind of narrowed it down pretty quickly to groups that Thomas felt would kind of philosophically align where I wanted to go.
I obviously wish all or most sellers were like Dr. Vasut and would be direct, have an idea of what they wanted, or at least ask the right questions where they could decide what they wanted. These are the types of sellers that we can do our best job.
So I did a lot of, the catchword was due diligence, but I did a lot of that on my own because I was not only concerned about, myself, but I had staff I wanted to make sure were taken care of. I wanted to make sure the practice continued to care for kids in the way that I wanted them cared for.
The group he ultimately went with was a good balance of cash and equity, and the opportunity with the equity was great. I'm confident we got him significantly more money and better terms than if he had just gone direct to maybe 2 or 3 of the groups that he might have known some buddies that had partnered with.
Now, I would think most doctors that have started a practice are interested in, okay, what is the legacy of that practice? And in my case, I wanted to make sure that, certainly that I was taken care of, but more importantly, the staff were taken care of, that the practice continued, there'd be continuity, and that just because I fade away, the practice doesn't fade away.